This is Lab 2, which is over the heart. Lab 3 is also over the heart, so they're both condensed together or put together in the same topic in Google Classroom. So here are your objectives. Many of these, like doing blood pressure, doing pulse, we'll actually do those in class. So this is just a quick overview of the notes for this. So with the heart, the mediastinum is an area of the thoracic cavity, which you remember from AMP1, between the lungs. It contains the heart, esophagus, trachea, those kind of organs. The pericardium is the membrane enclosing the heart. The apex, and if you're listening to this with this anatomy, you should have the pictures in front of you. That will make it easier if you want to use it as a review. So the pericardium is a membrane enclosing the heart. The apex is the pointy end, the inferior end, so the far end. Usually when you think of apex and the pointy part, it's on top. In this case, it's on the bottom. And the base, and again, if you look at the picture, you'll see it. It's where all the major blood vessels, pulmonary artery, aorta, veins, go into and out of the heart. So it's actually kind of the superior end, which is kind of the opposite of what you think. The auricles are the flaps that cover the atria. They kind of look like elephant ears. You'll see those also on the sheep heart. So the heart is two pumps, the systemic and pulmonary pump, the pulmonary being the right side, systemic being the left. On each side you have 4 chambers. Not on each side. On each side you have 2 chambers. You have a total of 4. So the atrium are on top. You have the right and left. The ventricles, left and right, are on the bottom. The best way to learn these parts, and I'm sure I've said this to you more than once, is to learn the order of blood flow through the heart. Learn them in that order, learn the parts in the order, and you'll have an easier time. The interventricular sulcus is an area of indentation on the anterior and posterior surface of the heart. It's where the major blood vessels are located. So it's not something that's easily to point to other than you can see the major blood vessels of the heart. The coronary vessels are located there. Again, here you have all the arteries and veins that go directly into or out of the heart. Again, the best way to learn these is just to learn the order of blood flow through the heart, which is in a video. The one exception to that is the coronary sinus. The coronary sinus is the large vein in the posterior part of the heart that's going to dump blood from the heart back into the right atrium, okay, back into the right atrium. And you'll see that on the picture, one of the pictures, the posterior view of the vessels of the heart. These superior and inferior vena cava, pulmonary artery, veins, and aorta, those are all discussed and used when you go through order of blood flow through the heart. So the coronary circulation is the circulation that goes to the heart itself. So the heart not only pumps blood to the whole body, but it also delivers blood to itself, where the heart muscle is going to take up the oxygen and get its nutrients, and then it also has to take the blood that it's used and bring it back to itself. And that's actually what the coronary sinus does. All the blood that's used by the heart to get its oxygen and nutrients are going to head back to the coronary sinus within the heart and then dump back into the right atrium. So you'll have the right coronary artery, the marginal artery, and the posterior interventricular artery. Use the name to help you where it is. Posterior in the back, interventricular between the ventricles. That are branches off the coronary artery supplying blood to the right side of the heart. The left coronary artery branches into the anterior interventricular, so in the front between the ventricles, and the circumflex artery, which branches off and goes around to the back of the heart. So the heart delivers blood to itself through these coronary arteries. That blood then ends up being deoxygenated. It then has to go back to the right atrium. It will do that. Most of it will go back through the great cardiac vein. The great cardiac vein is then going to dump into that coronary sinus that I mentioned, and then it goes back into the right atrium. So what you see with the heart is if the heart gets weaker because the heart muscle starts to die, not only does it not deliver blood well to the whole body, it also doesn't deliver as much blood or as efficiently to itself. So that can become an issue because then the heart can become weaker and weaker. You have the 4 valves. The valves are going to separate the chambers. The 2 that are going to separate the chambers are going to be the tricuspid is going to separate the right atrium from the right ventricle. the bicuspid or mitral, and I want you to identify both, is going to separate the left atrium from the left ventricle. The semilunar valves are going to separate the ventricles from the major blood vessels. So the pulmonary semilunar is between the right ventricle and the pulmonary trunk and pulmonary artery. The aortic semilunar is between the left ventricle and the aorta. Again, learning these in the context of the order that blood flows through the heart is the way to do it. I've gone over it. There's also a video you can watch. A couple other structures. The trabeculae carni are the ridges in the heart muscle, and they're identified on a picture. So when you look at the ventricle, you'll see these ridges in the myocardium or the heart muscle wall. Those are trabeculae carni. The papillary muscles are part of this trabeculae carni. They're an extension that actually attaches and helps the valves contract. So you've got the valves, okay, you've got the valves. Then you've got these chordae tendineae that connects the valves to the papillary muscles. So the valves on your pictures, and again you should be looking at those, the valves are white. Okay. Chordae tendineae are these white extensions that come off the bottom of the valve, and those attach to the papillary muscles, which are attached to the trabeculae carni. So again, this will be much easier if you're looking at the pictures, okay, looking at the pictures. So you've got the valve, okay. The chordae tendineae are the extensions that come off the valves, the white kind of stringy things. Those attach to the papillary muscles, which are painted red, and the papillary muscles are an extension of this trabeculae carni, which are the ridges of the heart muscle. We're also going to do a sheep's heart with this, and we'll go through that in class. Trace the order of blood flow. We've gone over that. Also watch the video, and again, learning these parts, the valves, the chambers, and the blood vessels is easiest when you learn them by going through the order of blood flow through the heart. You will hit them all. Okay. Some other structures of the heart that you need to know is, and we've talked about this, or we will, if you watch this before we go over it, that blood flow through a fetus's heart before it's born is different than after. And the reason is because blood does not go to the fetus's lungs, okay? It does not go to the fetus's lungs. Through the placenta, blood flow goes through the placenta. The fetus's blood is going to get oxygen from the placenta in the mother, and it's going to get rid of carbon dioxide through the placenta also. So the lungs are not functional until after the baby is born. So there's a few structures there that are going to maintain this fetal blood flow. So the first one is the ductus arteriosus, a normal fetal artery that connects the aorta to the pulmonary artery. So blood does not need to go into the pulmonary artery because we're not going to send blood flow in a fetus to the lungs. So what happens is when the ventricles contract, all the blood is then going to be detoured through the ductus arteriosus to the aorta, okay, to the aorta. So this is open in fetal development. Right after the baby is born, the lungs start to function. The lungs start to function. We then don't want all the blood going into the aorta. We want blood going to the pulmonary artery that's going to take blood to the lungs. So that tissue will fibrous remnant. It will shut off. So in a baby's heart or an adult's heart, that structure after it closes is called the ligamentum arteriosum. Okay, the ligamentum arteriosum. So when you look at the adult heart, which is the pictures you have, if I point to that structure, and there's a picture, it's called the ligamentum arteriosum. If I ask you, what was this in a fetal heart, then you say the ductus arteriosus. Another structure that exists in the fetal heart is the foramen ovale. And this is the opening between the left and right atrium that exists because we're bypassing pulmonary circulation. So everything's going into systemic circulation. Foramen, remember from the bones, means hole. So there's an opening between the right and left atrium in a fetal heart. Again, right after birth, this is going to close. This is going to close, and you're kind of left with a little remnant there. That remnant is called the fossa ovalis. Okay. So again, in the hearts that we're looking at, if I ask you what it is, on that adult heart or baby's heart, it's a fossa ovalis. If I ask you what was that in the fetal heart, then your answer is foramen ovale. Okay. Different heart sounds, we'll use a stethoscope to listen, and you're going to hear a lub-dub, which is actually one beat. Lub-dub, lub-dub, lub-dub. So that was 3 beats. What you're hearing, you're not hearing the heart contract. You are hearing the valves close. Okay, you are hearing the valves close. So the lub you hear, the first sound, is the tricuspid and bicuspid valve closing. The dub, the second sound, is the pulmonary and aortic semilunar valves closing. So what a heart murmur is, a doctor, and again you usually hear heart murmurs, you hear a lub dub swoosh or a lub swoosh dub. So let's say you hear lub dub swoosh, lub dub swoosh. That swoosh they're hearing is actually blood backflowing, and that can be happening because these valves are not closing properly. If the valves are not closing properly, blood can go backwards, and a doctor may hear a swooshy noise. So it's not uncommon to have people your age or older on a medical history write that they had a heart murmur when they were a kid and now it's not there. It can become a problem. If you get those as an adult, if the valves are not closing properly, what can happen is blood is flowing backwards, the heart is not exerting enough pressure and not moving the blood properly. All right, when you take a pulse, and we will do that, just some basic rules here, but we'll go over it. Don't use your thumb. Your radial pulse, you should know this, radial artery, the radius bone is on the lateral side of the wrist. The carotid pulse is just anterior to the sternocleidomastoid muscle in your neck. When you are feeling a pulse, you are feeling the pressure difference between ventricular systole, when the ventricles are contracting, and ventricular diastole, between contracting and relaxing. So as the ventricles contract, it's systole. As they relax, it's diastole. So you're feeling a pressure difference. You are not feeling the heartbeat. You are feeling a pressure difference. So when you feel it go through your thumb or your fingers, systole, then you feel it diastole, systole, diastole. We will go through how to take blood pressure. We will do that. What causes systolic blood pressure is ventricular systole. The direct cause of diastolic blood pressure is ventricular diastole. Definitions of systole and diastole we will go over in lecture. If we haven't done them yet, I will go over them in lab. Values for hypotension, blood pressure that's low, which can cause problems with lightheadedness, 90/60 or below. Values for hypertension, 140/90. The average blood pressure is 120/80. Very few people have exactly an average blood pressure. So if you're a little above or a little below, it's fine. Most people in your age group, especially females, it's not abnormal to see a blood pressure below 120/80. In many cases, sometimes it can be below this systolic can be below 100, and that's okay. Long-term hypertension needs to be treated. It can cause an increase in heart disease, stroke, kidney disease, and blindness. Number 8, the Valsalva maneuver we'll discuss, is basically when you breathe in, you breathe out, but you don't let the air out. You actually close your glottis, which we'll talk about that when we get to digestion and respiration. You don't let the air out. So you take air in, you breathe out, but you keep it in. And what that does, it puts pressure against the heart. In some cases, it can be used to help get rid of a heart arrhythmia. So if someone's heartbeat goes up very quickly, one way for them to settle it down or other arrhythmias is to induce the Valsalva maneuver. That puts pressure on the heart, which can slow it down or get rid of the arrhythmia, at least temporarily. That's a case where the Valsalva maneuver can be used in a positive way. On a negative side, if someone is lifting weights, it's really important, or exerting a lot of force or pressure, they need to make sure that they're not doing the Valsalva maneuver. So you want to make sure they're breathing. What can happen is, let's say someone's doing a bench press, and in order to get the weight, because they're right near their max, to get that weight up, they do the Valsalva maneuver. They might not know they're doing it, but what they do is they take breath in and then they don't let it out. They push out, but they don't let the air out. What that can do can put pressure against the heart. Not only can that slow the heart down, which in this case can be a bad thing, it can also decrease blood flow out of the heart, decrease blood to the brain. It can cause someone to faint. And what that can do, imagine if you had 200 pounds of weight over your head, no one's there, you induce the Valsalva maneuver and you faint and you drop that weight, it can cause obviously it can cause death. So you don't want to be doing that during physical exertion. You don't want to be exerting the Valsalva maneuver. And then we will do blood pressure. We'll do that in class. Okay, so this is just a quick overview of the lab. Again, we'll go over it in class, but if you want to listen to it, the basics again, here you go.